Hello, I'm Dr. Frida, and this is my practice manager, Shador. And thank you for joining us for this Lunchtime Live, this YouTube Live, where you have the chance to get your questions answered live. Today's topic, kidney stones. And we are live here in Atlanta, Georgia at Emory Midtown, at my office here in Emory. Remember that these YouTube live sessions are informational. They do not replace your visit with your physician. So everyone should be consulting physicians for questions on your particular care. Well, let's get right into it. Let's talk about kidney stones. Now, kidney stones are a real issue. They are more common in men than women. About 10% of men will have a kidney stone during his lifetime, and about 7% of women. And they can cause debilitating pain, they can cause kidney infections, and they can even cause kidney disease. So today we'll be talking about kidney stones, the different types of kidney stones, and really I'll be going off of you and the questions that you've sent in or that you give me right here live. All right, Ms. Shador, let's get started.
Okay, well, I'll briefly start with a couple of questions that came in prior to, and then as questions come in today, of course, we'll get to those.
Okay.
The first question comes from Princess Zara.
Hi, Princess Zara.
I am diagnosed with urolithiasis.
Okay.
Is that right?
Urolithiasis.
Urolithiasis.
Yes.
I have a 3.5 millimeter kidney stone and UTI. I was advised to undergo shock wave procedure. Would there be a risk if I don't undergo that procedure?
Okay, so urolithiasis, or stones in the urinary tract system. A 3.5 millimeter stone for most people is small enough to pass. If the stones are 9 millimeters or less, usually they're small enough to pass through the urinary tract, through the ureters, through the bladder, without any kind of a surgical intervention. So it is a small stone. However, even when the stones are small, depending on your anatomy, it may get stuck in some of the tubes in your kidney system, in your urinary tract, which is likely why it's been recommended that you have the shockwave procedure. Now, you mentioned that you've had UTIs, which stands for urinary tract infections or bladder infections, and that can be a complication of kidney stones. Now, if you're getting recurrent UTIs or recurrent infections, this can become a long-term problem because it can lead to large infection of your kidneys, and even that infection can go outside of your kidneys, causing sepsis or overwhelming infection. So these repeated UTIs, if they're related to the kidney stone, which likely they are, it's a problem. If it's been recommended that you have that shockwave lithotripsy or that procedure, you definitely need to ask your urologist exactly why you're needing it with this small stone. And if they say, what I predict they'll say, that your stone, even though it's small, it's not passing, and if they list the different reasons, including the infection, then very likely that is the procedure for you. With every physician and every recommendation, if you're not totally comfortable with it, first ask the questions to the recommending physician, and then get a second opinion. It's not offensive for you to get a second opinion. It's just you being your own advocate. But again, that is a very small stone, which usually for most people will pass on its own, but ask the questions why it's been recommended for you. And if you're told it's because your stone is not passing and you're now at risk because of all of the infections, then it may be the procedure for you.
What's the, generic, how does stones typically form?
Okay, so kidney stones are exactly what they sound like. They are stones, they are rocks in your kidneys. And they form when different particles, different substances that are in your urine stick together. They stick together, and then other particles come and stick on that particle, and then eventually you have a kidney stone. Some things that put you at risk for kidney stones are dehydration. You can imagine if you have a very concentrated urine, or a urine where you have a lot of particles with not that much fluid, where the particles have an easier time finding each other and sticking together, and so you get the kidney stones. Other risk factors, diabetes. If you have gout, that can be a risk factor for a kidney stone. Also, if you've had a gastric bypass surgery, you can be at risk. Or if you have Crohn's disease or any disease that causes you to have a whole lot of uptake of oxalate. And oxalate is another substance, if you have it and it's high in your diet, which can put you at risk for stones. Basically, particles in the urine concentrated urine, especially when you're dehydrated, put you at risk for getting the stones.
What type of test can be done to know what type of stones you have?
Okay. So a CT or a CAT scan without contrast of the kidneys and the ureters and the bladder is really the gold standard test that goes through, and it takes thin slices as far as the pictures, and it shows whether or not you have stones. There are some other imaging, like an ultrasound can give you an idea, but really a non-contrast helical CAT scan is a study of choice to see if you have a stone.
Now, I know here in the office, you sometimes do a 24-hour urine test for those patients, or your risk panels for patients. Do you necessarily have to have a stone to give the technician?
That's a good question. So the Uro risk panel that Shador is talking about is when I have patients collect all of their urine for 24 hours. That doesn't make me that popular when I ask them to do that. What that does is it lets me know what kind of particles are in your urine and what concentration. So do you have a lot of calcium, oxalate, sodium, uric acid, potassium? It lets me know the likelihood you have of forming particular stones. Now, the most common stones have calcium in them. Calcium oxalate is the most common stone. So if you're someone who has a whole lot of oxalate in that urine, a whole lot of calcium, and even if you have a lot of sodium, that lets me know, okay, even if I haven't actually seen the stone, most likely that's a stone you have, and so I can treat you accordingly. So that's why I have the 24-hour risk. And no, you don't necessarily have to have the stone to treat it, but if the urine is strained and the actual stone is caught, then that really gives us the absolute best chance of treating you properly for the kidney stone.
Good to know. From viewer Millie Armstrong.
I'm Millie Armstrong.
What if a person has had kidney cancer? Can that be a concern for kidney stones?
Kidney cancer, well, it's a concern, just period, of course, having a malignancy or cancer of the kidney. But the kidney cancer in and of itself is not necessarily a predictor for having kidney stones unless you have a certain mass that's inside of the collecting system, which is causing some of those particles get caught up in making stones stick. But in and of itself, if kidney cancer is the issue, then certainly that far outweighs any concerns about kidney stones, and that wouldn't be my biggest concern for kidney cancer.
Thank you. Hi to our viewers. If you have any questions, just remember to type those in for us and get those answered by Dr. Freeman live here today. From Glenwood Jenkins.
Hi, Glenwood Jenkins.
Can you get a kidney stone in your bladder?
Good question. Yes, you can get a kidney stone in your bladder. The way that the anatomy works, so you have your two kidneys, and they're back in your flanks where your love handles are. And you have all types of tubing inside of your kidneys. This tubing collects on each side in something called a ureter. A ureter is that tube that connects the kidney to your bladder. And you know where your bladder is because that's what feels full when you have the sensation of having to use the restroom, having to urinate. When you pass a kidney stone, it will go from the collecting system in your kidney, pass through the ureter, that tube, and it can enter the bladder before it exits your body through the urethra to the outside world. So absolutely, you can have what originated as a kidney stone in the bladder.
Okay, good. From Tremaine.
Hi, Tremaine.
Can anything actually dissolve kidney stones?
That's a good question. Now, with kidney stones, the best thing to do is to try to prevent them from forming in the first place. So things like being hydrated, that's most important. Most people should be having at least 3 liters of water a day to keep that urine flow going, to keep the particles in the urine from being too close or concentrated. But again, you need to consult your physician to make sure of what level of water you should be drinking. Other things, having a low sodium diet can help to prevent stones, and having high citrate in the diet. Potassium citrate can help, and lemon juice can help as far as preventing stone formation. And some believe that it can help to dissolve stones. But for the most part, the prevention is the key, and it's not as easy to dissolve stones, although, again, high urine flow, high citrate, high potassium citrate can, in some cases, help dissolve stones.
For those of us who are not fond of drinking water, what kind of tips can you give to help with the water intake?
Drink it. Water
Can I add lemon juice?
is your friend. So yes, you can Add lemon juice to water for flavor. You can cut up strawberries, cucumbers, do different things. For me, I have to drink my water room temperature. Some people really enjoy water. They put ice in it and they want to sit there and sip on it while they watch TV and Netflix binge. Not me. I have to get my water, have it room temperature so that it goes down easily. And literally, I keep count on my ounces of water I'm taking in, and I just have to chug it. I don't need the lemon. I don't need the other stuff. Just get it over with, because water is so good for us and it helps to prevent kidney stones. But for those of you who need some extra help with it, some water flavorings, even some of the sugar-free Crystal Light, as long as you get the water in your system. And again, consult your physician to find out what's best for you. But 3 liters, or at least 2 to 3 liters for most people, is going to be a good, adequate water intake at the minimum.
Thank you, Dr. Frida. From Michael O'Loughlin.
Hi, Michael O'Loughlin.
I have had kidney stones 7 times after my urologist did detailed evaluation and found precancerous cells in my urine. Now what do I do?
The precancerous cells in the urine now become the priority. So what the urologist will likely recommend is that you have imaging looking at all of the kidney system, the kidney, the ureters, the bladder, and the connection from the bladder to the outside world, the urethra, that tube through which urine flows. In that imaging, they may recommend ultrasound to start, or an MRI for more detail, and they'll be looking for any signs of cancer, any masses. If they see any signs, or even if they don't, the next step will likely be endoscopy, where the urologist actually they go through the urethra, or the urine hole, the pee hole. They take that tiny camera, they go up through the urethra into there, ureters, to take samples to see if there's any cancer. And they'll also likely have you to do, if they haven't done so already, a 24-hour urine looking for the cancer cells. So yes, once cancer is involved, that becomes the tip-top priority. So make sure you continue to follow up with your urologist, and probably even a cancer doctor, an oncologist, to find out if the cancerous cells are putting you at high risk for actual cancer, or if it's a false positive. Be sure to follow that up.
Thank you for your question, Michael.
Yes.
For patients who have had kidney stones or history of it, is it necessary to see both the nephrologist and urologist? And if so, who should you see first?
That is such a good question. That's often a confusing question, not only for patients, but also for physicians. Do I send you to a urologist, the kidney surgeon, or to the nephrologist? So let me just start with the difference between a nephrologist and a urologist. The nephrologist takes care of all of the medical issues with kidney disease. We take care of pre-dialysis patients, patients with chronic kidney disease. We talk about how to prevent kidney stones from a medical standpoint, not only lifestyle, but with certain medications that help to prevent kidney stones. We also deal with blood pressure, electrolyte abnormalities, all of those things. But most of us don't actually do the surgeries, though there are some interventional nephrologists who will do some procedures. The urologist is the actual kidney surgeons. Urologists go in and perform the surgeries or the procedures to remove kidney stones. Urologists go in with the cameras to look up and to actually see the anatomy from the inside out of the kidney system, and the urologist can do the biopsies. A nephrologist is to a urologist as a internal medicine doctor or family doctor is to a general surgeon. So when it comes to kidney stones, if you're having some of these acute issues like pain, nausea, vomiting, fever, and you're acutely ill, and there's likely a procedure or an intervention that needs to be done, then you need to see a urologist. But then when it comes to the prevention of future stones and getting an evaluation of the kind of stone you had and what is going on in your body that has perhaps predisposed you to the stone, the nephrologist will do the ongoing treatment. And we work hand in hand with urologists. So yes, I'm a nephrologist, and I work hand in hand with the different urologists we have here in Atlanta to help to prevent and to treat kidney stones. So you might have to see us both.
Have Vera Inez with us today.
Hello, Miss Inez.
She asks, are kidney stones hereditary?
Ooh, good question.
And do young children get kidney stones?
Very good question. So kidney stones actually can be hereditary. There are certain diseases that predispose you to having high calcium in the urine. And I mentioned some of them, like Crohn's disease. A lot of people with Crohn's will have high oxalate in the urine. And if people have diseases that cause them to have hyperparathyroidism, so the parathyroid hormone comes from your parathyroid glands, which are on the four corners of your thyroid. If you have one of these genetic predispositions where your parathyroid hormone is causing you to have high calcium in your body, that can put you at a genetic predisposition to having high calcium in the urine and therefore stones. Children can get kidney stones if they have some of these genetic predispositions, but for the most part, kidney stones are less common in children and more common in adults and more common in males than females. But certainly if a child is having symptoms of kidney stones, pain in the flank, pain that radiates from the flanks up toward the front and the groin, this colic pain. If the child is having blood in the urine, if the child is having fever, nausea, vomiting, along with this flank pain, then certainly take that child to the pediatrician or even to the emergency department, depending if it's after hours or if the pain is severe, because certainly children can get kidney stones, even though it is less common.
Thank
Good
you for the
question, Ms. Inez.
Have Julianne, I'm sorry, with us here today. Hi.
Hi, Julianne.
Had kidney stones last summer.
Oh, sorry, Julianne. Thank you for joining us.
Raven Craft, hello. Thank you for joining us
Hi.
as well.
Thank you for sharing the Lunchtime Live with us. I appreciate you.
She says, I was diagnosed with kidney stones a year ago and have had ongoing kidney problems and drink 3 to 4 liters of water a day. Doctors don't care anymore and still suffering.
What was the last part?
She said doctors don't care anymore. She's still suffering from kidney stones.
That's awful. First of all, I'm sorry that you're having to suffer with kidney stones because it's something. Kidney stones is one of those illnesses that will cause my big, macho, tough people to cry. So I can only imagine how tough it is for you to have the kidney stones. And I'm sorry that you're going through it. You are doing the right thing in that high water intake because, again, that's keeping those particles from being able to stick together as easily, and it's helping with the urine flow. If you are still having the kidney stones, then I strongly recommend that you see a nephrologist if you haven't seen one already, because you sound like someone who should have that uro risk panel, that 24-hour urine, to find out why you're having the kidney stones. Do you have too much oxalate? Do you have too much calcium in the urine? Do you have too much sodium? Now, again, calcium oxalate stones are the most common stone. So one of the ways to prevent those, in addition to drinking a lot of water, is to have a low oxalate diet. Now, what in the world is oxalate? It's something that's found actually in a lot of healthy foods, unfortunately. Spinach is high in oxalate. So if you have a high spinach diet, doing those healthy salads with spinach, that could be predisposing you to stones. If you eat rhubarb, that's high in oxalate. Avocado is high in oxalate. Nuts are high in oxalate. Almonds, figs, all these things I mentioned, I know are healthy things, but those are high in oxalate. Even teas, I know a lot of people love green tea. Teas can be high in oxalate as well. So reducing the oxalate in your diet, in addition to drinking water, can help to prevent stones. High sodium diet can also predispose you to recurrent stones. You should try to limit your sodium to 1,500 milligrams a day. That sounds like a lot, is not. It's really not. So 1,500 milligrams a day, limiting it, just to put things in perspective. If you think about 2 vegetarian sausage links, that sounds healthy. Okay, 300 milligrams of sodium. And you like ketchup? Mm-hmm. I like ketchup. 1 tablespoon, 197 milligrams of sodium. Even a can of corn has almost 500 milligrams of sodium. My point is, even if you don't pick up the salt shaker, there's sodium in everything. So become a label watcher. Try to decrease the sodium in your diet to help with your stones. The other thing is if you have gout, if you have Crohn's disease, so the gout will predispose you to high uric acid, and there's a such thing as uric acid stones. So really, again, you need to get that urine evaluated. And if you can catch any of those stones, like with a little strainer or streamer, catch a stone and bring it into the nephrologist or the urologist to be treated. If you're having recurrent stones, there's a reason. It could be UTIs. If you get a certain type of bacteria that's in your urine, certain bacteria will predispose you to huge, large stones. So make sure that you do follow back up with your doctor or find one where you have a connection, you feel like they're caring for you. But I would start with a nephrologist if you're not having acute symptoms, and you'll likely need to work in conjunction with a urologist. Thank you for joining us. And if you have any other issues, just comment and I'll get back with you.
Thank you, Julianne. Welcome, Ramsari and Morgan.
Hi, Ramsari and Morgan. Thank you for joining the Lunchtime Live.
Viewer says I'm 23 and was diagnosed 3 days ago.
Oh, shoot.
I have a 2 millimeter stone in my right kidney and a 1.6 millimeter stone in my left kidney. What can I do at home to pass it?
Very good. So fortunately, with those stones being so small, again, those are less than the 9 millimeters, the chances are great that you will pass those stones on your own. Water, water, water. So drinking that minimum of 3 liters of water a day, again, will help to increase your urine flow and to help to push those stones further down. Making sure that you take in things that will alkalinize your urine, like potassium citrate, lemon juice, preferably organic, but a good lemon juice. Drinking that can help to further along the stone, assuming that it's a calcium-containing stone, like a calcium oxalate stone. Pay attention. Look at the urine that you're making to see if you see any kind of particles. As long as you are able to drink, eat, and as long as you're not having debilitating pain, not having nausea, not having vomiting, not having signs of urinary tract infection, then this high fluid and the potassium citrate and the lemon juice, you should be able to pass those stones on your own. If not, and if you get some of those symptoms, follow up with your physician.
Now, when you say particles, would it be kind of like sand, something like that? Exactly what would you be looking for?
It looks like rocks. It looks like little grains for most people. And it depends, because like some calcium oxalate stones are darker, some are whitish yellow looking. The stones may have a different look. But honest to goodness, every time I've seen kidney stones, I look and I'm like, not my kidney stones, but in my practice when I've been rotating through hospitals, they just look like pebbles. I'm like, they call these kidney stones because they are stones, they're little rocks. And so that's what they'll look like, little granular pebbles most of the time.
Wow. Thank you for joining us, Vendetta. Hi.
Hi, Vendetta.
Yes.
I like that.
She says, a question a little off topic here, but I have fibroids, 6 centimeters on my right, 2.2 on my left. How can you treat those at home?
At home. Okay, now for the fibroids, it's going to depend on your symptoms. If your fibroids are causing you to have heavy bleeding or menorrhagia, if they're causing you to be anemic, if the fibroids are causing you to have extreme pain, definitely you need to see your gynecologist and get the treatment. And if you're someone who's interested in having babies, you want to find out where your fibroids, if your fibroids are located in a place that can cause a problem with fertility. So in that case, I definitely suggest that you see your gynecologist. I wouldn't so much try to treat those at home. Of course, do things as you would exercise, healthy diet, staying hydrated, having a good lifestyle in that manner. But as far as actually treating the fibroids, depending on your goals in fertility life, depending on your symptoms as far as anemia and whatnot, it's going to depend. So again, consult your physician, specifically your gynecologist, for the fibroid treatment.
Thank you. Kavita, thank you for joining us today.
Hi, Kavita.
She apologizes for being off topic.
You know what, Kavita, where are we going?
Well, my GFR is 68.
Okay.
And my kidney doctor said I'm stage 2, mild. But is there any way I can increase my kidney stage between I'm 49 years old and a non-smoker? Can she, I guess, get to a place between stage 1 and stage 2?
Yes, it's possible. Now, again, it depends on why you're in stage 2. So just to do a brief overview, there are 5 stages of chronic kidney disease. 1 is the best, and it's when that GFR is 90 or greater. 5 is the worst. That's when that GFR, or the percentage kidney function, glomerular filtration rate, is less than 15. When the GFR is less than 15 and you're at stage 5, that's when it's time for most people to either get a kidney transplant or to be on dialysis, some form of renal replacement therapy. At stage 2, that's really a good place to be. Of course, stage 1 is the best. And the first thing to do is find out if it's a chronic kidney disease state at stage 2, or has something acute and reversible happened, and maybe you can pop back up and get into the totally normal stage. Hydration. good hydration is number one. That 2 to 3 liters, depending on what your doctor recommends, helps to flush that kidney, get the creatinine down in a lot of people. Think about how much water you're drinking. Now, if you know good and well that you're only sipping on 1 bottle of water and that gets you through the whole day, then start with a hydration. 4 to 6 of those 16-ounce bottles of water, assuming you don't have any heart problem or lung problem that prevents you from drinking all of that water. But for most people, 4 to 6 bottles or even more of the 16-ounce bottles of water can really help to get you some points on that GFR to take that 68 up to a 70 or even higher. If you're a person who's doing a lot of pain medicine, particularly NSAIDs, non-steroidal anti-inflammatory drugs. So these are the ibuprofens, Motrins, Advil, naproxen, meloxicam. Now again, these medications are great drugs unless you're having a kidney issue. And in those cases, sometimes the NSAIDs can make it worse. Talk to your doctor about it. But think about what you're taking. If you're doing a lot of pain medicines from the NSAID category, cut back on those. And as long as you don't have any liver issues or any allergy, then Tylenol or acetaminophen would be the medication of choice not to hurt the kidney. Diabetes is a number 1 cause of kidney issues or CKD. Make sure your blood sugar is in control. High blood pressure is the number 2 cause. Make sure you have a normal blood pressure. That top number being less than the 120s, that bottom number diastolic being less than the 80s. But again, go into your doctor, and at 68, most primary care physicians like internists, family doctors can help to guide you into improving the kidney disease. But you may even want to do an initial consultation with a nephrologist just to really get an intense counseling on taking care of your kidneys. Good luck to you.
Well, I think maybe a common question. Apple cider vinegar. Does that help with, I guess, preventing kidney stones or breaking down kidney stones?
Oh, that's such a good question. Do you know there are so many people who love apple cider vinegar? You got people who use it as facial toner, scalp treatments. Yes, I'm talking about you, cousin April. You have people who use it for digestive system. You have people who use it as a prevention of kidney stones. And I will tell you the truth. I actually use apple cider vinegar for a lot of things. And even though there are not a whole lot of large, randomized, controlled, scientific trials on apple cider vinegar, which would allow me to tell you definitively, yes, apple cider vinegar will help, I'll tell you, for most people, it won't hurt. So I still say consult your physician about the kidney stones and do the things that I've talked about that have been proven, such as drinking a lot of water, doing the potassium citrate. But if you do a little bit of a teaspoon of apple cider vinegar once or twice a day, I don't know that it will help your kidney stones, but it can help certain things and it certainly won't hurt. So,
well, thank you, Dr. Frida.
All right. Thank you, Ms. Shador. Thank you to everyone who joined us for this Lunchtime Live. Again, this is informational. It does not replace your doctor's consultation. Make sure that if you have not done so already, subscribe to my page, share this live, ask questions, and let me know what you want us to talk about for future Lunchtime Lives. Make sure you take care of you, prioritize yourself and your health, and do your best to live your healthiest, happiest life. Thanks for watching Lunchtime Live. That was good. I liked